Syphilis. I know what you might be thinking. Isn't that a disease from old history books or something? Well, believe it or not, it's making a huge and kind of dangerous comeback. So today, we're going to dive into how this ancient infection works, why it's suddenly surging, and, most importantly, what we can do about it. All right, let's break it down. Let's just start with this number. Over 200,000. So what is that? Well, that's how many cases of syphilis were reported in the United States in 2023 alone. Yeah, this isn't some dusty old statistic. This is a public health crisis that's happening right now.
In this chart, wow, this really puts it all into perspective. Just look at that jump. If you go back to the year 2000, there were only about 6,000 cases. To go from that to over 200,000, that's just a staggering increase. It tells you that something has fundamentally changed and not for the better.
Okay, so here's our game plan for this explainer. We'll kick things off with why this is a modern epidemic. Then we're going to walk through every stage of the infection, from the very first sign to the silent damage later on. And we'll wrap it up with the good stuff, how it's diagnosed, treated, and, of course, how we can prevent it. So first up, syphilis as a modern epidemic. I mean, it's a fair question, right? Why is this ancient disease, one we've known how to cure for decades, suddenly roaring back in the 21st century? At its heart, the explanation is pretty simple. Syphilis is a sexually transmitted infection, an STI, and it's caused by a little spiral-shaped bacterium. And that one microscopic organism, that's the root cause of everything we're about to get into. That brings us to our next section, the first sign. This is what's known as the primary stage. You can think of it as ground zero, the very beginning, when the bacteria first get into the body. The classic sign of this first stage is a sore, and it's called a chancre. It's usually a firm, round sore that shows up right where the infection started. But here's the really sneaky part, and it's a huge reason why the disease spreads so well. The chancre is completely painless. It doesn't hurt. So as you can imagine, a lot of people don't even know it's there. A chancre usually shows up about 3 to 4 weeks after exposure. But this is where the disease gets really tricky. That's sore. It often heals up completely by itself in a few weeks, even if you do nothing. And this creates a really dangerous false sense of security. Someone might think, oh, well, that weird thing is gone. But in reality, the infection has just moved inside to get started on phase 2. And please don't underestimate how contagious it is at this stage. This statistic is pretty powerful. The chance of getting infected from just one encounter is about 1 in 3. And that risk goes up even more if the person has an active open sore. So, if it's left untreated, the infection moves on. Welcome to the secondary stage. This is when the bacteria have multiplied and have basically hit the highway, your bloodstream, to spread throughout your entire body. A key sign of this stage is a really unique rash. It's not like most rashes you'd think of. This one often appears on the palms of the hands and the soles of the feet. And, true to form for this disease, it usually doesn't itch or hurt. It's another one of its very deceptive traits. Now, the symptoms are body-wide. People can get a fever, feel really tired, have swollen glands, even lose their hair in patches. They might also get these raised, kind of warty-looking growths in moist areas of the body. And, just like that first chancre, all these symptoms can also just disappear on their own, tricking a person yet again into thinking they're totally fine. Okay, now we get to the most dangerous part of this journey, the later stages. After those secondary symptoms fade away, the disease goes into hiding. It enters a silent or latent period that can last for years before it potentially comes roaring back in its most destructive form.
During this latent stage, there are no outward signs at all, no symptoms. The only way you would know you have it is through a blood test. Now, in the early phase, within that first year, you can still be contagious. Later on, you're usually not. But the key thing here is that the bacteria are still in your body, just silently doing damage.
If the infection is still left untreated, about a third of people will eventually get to this final tertiary stage, and this can happen years or even decades down the road. It can show up as growths called gummas that destroy tissue, or as damage to the heart and major blood vessels, or as neurosyphilis, where it attacks the brain and spinal cord and can lead to paralysis, dementia, and even blindness.
So that's the devastating where this disease can progress. But that is not the end of the story. In our final section, we're going to talk about the path to a cure, diagnosis, treatment, and prevention. This is where things start looking up. It's the big question, isn't it? If this disease can just go into hiding for so long without any symptoms, how in the world do we ever find it?
The answer is actually a pretty simple two-step blood test. Doctors start with a screening test. If that comes back positive, they just follow it up with a second, more specific test to confirm it. That's it. It's a really reliable process for catching the infection at any stage.
And the treatment for this really complex, multi-stage disease? Something that's actually remarkably simple and effective. Penicillin. A straightforward course of antibiotics can completely get rid of the bacteria in your body.
But, and this is a really big but, syphilis is totally curable. The infection can be wiped out. What treatment cannot do, though, is reverse any permanent damage that was done to your organs in that final stage, to your brain, your heart, your nervous system. That damage is permanent, and this is exactly why finding it and treating it early is so vital. Which, of course, means prevention is everything, and the strategies are pretty straightforward. You know, practicing safer sex, using condoms correctly and consistently, getting tested regularly if you're at risk, and making sure that if you are diagnosed, your partners get notified so they can get tested and treated too.
And that brings us right back to our final thought. We have a disease that is easy to find and simple to cure with a common antibiotic, and yet cases are exploding. It really leaves us with a critical question, doesn't it? In the fight against this ancient disease, is our modern awareness the real missing piece of the puzzle?